Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you are listening today. On today's episode, we're going to be talking about painful periods and other related symptoms. Now, painful periods impact as many as 10 to 15% of all women, and we'll discuss what causes these symptoms as well as how to treat your concerns in more natural ways. I'll also review when it's time to talk to a trusted healthcare professional about getting further evaluation for more serious symptoms and how to advocate for treatment plans other than birth control. So let's start off, as always, with a story about a past client of mine who we'll call Samantha. Now, Samantha came to see me when she was in her early 30s. She was having menstrual cycles that were very regular, and she was currently avoiding pregnancy. However, she had significant abdominal cramping when she had her period, lasting about 3 to 4 days each cycle. Along with this, she also noticed significant back pain, as well as diarrhea and headaches around the times when she had her period. Now, she had been recommended by her primary care provider to go on oral birth control as a way to treat those symptoms. However, Samantha was wanting to consider pregnancy in the near future, so she wanted to avoid that, but also to deal with her symptoms in a more natural way so that she wasn't suffering every single month. A friend told her about our clinic, and Samantha came to see me looking for some more natural alternatives to deal with the pain that she had each cycle. Over the course of the next couple of months, we worked together to find different things that would help relieve her symptoms. We focused on some lifestyle changes as well as changes with what she was eating and drinking. We also focused on some different supplements that can help with pain, as well as outlined a treatment plan going forward to let her know when it was time to advance that treatment to something more significant for evaluation if needed. I'm happy to report that Samantha was able to not only reduce her pain significantly, but when it came time to achieving pregnancy, she was able to do that in a way that allowed her to be on no other prescription strength medications while she achieved that pregnancy. So let's start with talking a little bit about what causes pain with periods. And a lot of women think that pain is just a normal part of having a period. And what we find is that uterine contractions are caused by prostaglandins. And what happens is that when you have those prostaglandins that are secreted, it increases your pain and inflammation. Now, the uterine contractions you have during the time of your period is literally your uterus, which has muscle tissue in it, trying to expel all of the blood products from when you aren't pregnant. And so when we have that pain, when we have that inflammation, that's where a lot of women will have troubles. Now, one of the things that we see is that, that pain isn't always just limited to the pelvis and to the uterine organs. And really, if you look at the anatomy of the pelvis, we find that lots of other things sit in very close proximity to that uterus. For example, your bladder sits right next to your uterus. Parts of your bowel sit right next to and on top of the uterus. And so when we have pain or inflammation coming from those areas, it can also flare up other areas around. For example, if you notice that you have diarrhea around the time of your menstrual cycle, that can be common. If you find that you're having to urinate more frequently, that can be common. Those can also be signs of other things that can be more serious. And so we'll talk about that in a little bit. But just the pain, the inflammation itself coming from that release of prostaglandins at the time of your cycle can cause some of these other symptoms. Other things that we know can make pain worse are certain lifestyle habits. So for example, if you are not sleeping well, if you're not getting enough sleep at night, that can certainly increase your pain in general. Also, if you have a lot of stress in your life and certain medications. And then the final area is certain eating habits. And so we'll talk a little bit as far as what to do in order to try and change your diet to help with that. But there are certain times when what you eat can directly impact how significant your menstrual pain is. Now, there are other symptoms that come along with periods for people that are beyond just the pain. So the most common ones that we see other than pain are going to be those GI symptoms. So whether that's diarrhea, nausea, vomiting, and then some people also notice neurologic symptoms. So dizziness, headaches, feeling lightheaded or like they have to pass out. It's really important to distinguish this from just having too much blood loss versus just a normal hormonal response to what's going on with your cycles. Other causes of painful periods can be certain health conditions, and this is where we really want you to be working with a healthcare professional to make sure that we're ruling out some of these more serious health conditions. The most common one that we talk about is endometriosis. And endometriosis is literally deposits of uterine tissue that can be located anywhere throughout your pelvis or your abdomen. And so in patients of mine who we've seen that have been treated for endometriosis, we can see that these tissue implants can end up even as high as your diaphragm, underneath your rib cage. They can be on your liver, they can be on your bowel, they can be on your bladder. And anywhere that you have that uterine tissue, when prostaglandins are secreted at the time of your period, also causes inflammation in those other areas. And so for women that have pain that's throughout their entire abdomen around the time of their cycle, it makes me really suspicious for endometriosis. Other things that can cause significant pain that should be evaluated would be different masses. So whether that's pelvic masses or masses that are in the uterus itself, ovarian cysts can also commonly cause significant pain. And then we also think about things that are not specific to the reproductive organs. For example, irritable bowel syndrome, urinary tract infections, sexually transmitted infections, or even just regular overgrowth of the normal bacteria that's there. All of these things can increase pain. And so it's really important not to just blow off pain or think, oh, this is just normal, everybody has it. It's really important to make sure that you are working with a healthcare professional who's evaluating all of these pieces and helping to understand if there is something more serious that can be treated. Now, let's switch gears a little bit and talk about some different options for relief. Now, there's a lot of different things that you can try at home to help with the symptoms that you may be having. Again, I would reiterate the importance, though, of making sure that if things are not improving within 1 to 2 cycles, that you're getting evaluation from a healthcare professional who can help you determine, is this something else that needs additional evaluation, prescription medications, or other referrals? So let's start with some of the stuff that we talk about on a regular basis here on this podcast, and that's going to be some lifestyle changes. So let's talk a little bit about sleep. Sleep is one of the most important things that we talk about from a hormone standpoint that you can change with your regular daily lifestyle. Now, I know it's not always easy to get sleep, and especially if you're having pain, it can be really difficult. But we know that your body needs that deep restorative sleep in order to be able to function well, to heal, and to decrease that inflammation. So please, please, please try and get that sleep. At a minimum, we're looking at 7 to 8 hours per night. Next thing we talk about is exercise. And I know for many women, when you're having your period, exercise is the last thing that you want to do. And I'm not talking about intense exercise during this point in time. What we're looking at is walking 30 minutes a day, 4 to 5 times a week. And we find that women who walk even prior to their menstrual cycle onset, that can decrease the intensity and severity of that pain that you have. Different things that you can do when you're on your menstrual cycle in order to try and help pain relief. We know that yoga can help with some people, and this may be as simple as just putting your legs up against a wall. So what this looks like is that you're going to lay on your back, you're going to scoot your behind as close to the wall as you can, and you're going to put your feet straight up in the air against the wall so that you're literally at a 90-degree angle. And we find that this can help with circulation. It can help to relax some of those muscle cramps that you can be having. Another one that you can do is child's pose. And so for those of you that may not know what child's pose is, it basically is if you sit on your knees, then kind of let your knees splay open to the sides, and then let your butt sit back as far as you can, and then move your arms to stretch out in front of you. What we find is that this can actually open up and kind of relax some of those muscles in the pelvis and can cause some significant relaxation of those muscles, which then in turn can help with decreased pain. The other thing that we talk about is always going to be what you're eating. And so it's very important when you're having your period to be having a significant increase in your water intake. We know that as you're losing fluids, we want to replete that blood store. And so having a good amount of fluid, especially through water, can be really helpful. Although it's not popular, we always talk about avoiding certain things too that can make inflammation worse. So think specifically about sugar, caffeine, salt, and for some people, gluten and dairy. Those can oftentimes make that inflammation worse around the time of your period and can really just add to that increased inflammation. So trying to avoid those foods or if you find there's a particular food group that makes things worse, just avoid that during at least the first couple days of your period. Now, let's talk about some other things that you can do proactively to help. There's been some great studies actually looking at the benefits of local heat. So whether that is a heating pad, they also make disposable heating pads that you can use if you're someone who's on the go, or taking a nice warm shower to let that warm water run over that area can really help those muscles relax. Other things that you can do would be to take certain herbal teas. So we find especially that peppermint, chamomile, and ginger herbal teas are really good for helping to relax those prostaglandins, help with decreasing inflammation. Now, it is important to make sure that you're looking for the teas that have those actual ingredients, not just flavored teas, because that makes a big difference in what you're getting. There's also been some great scientific studies done that look at the use of essential oils and massage when used in combination to treat pain around the time of your menstrual cycle. So specifically, these studies have looked at combinations that include lavender or combinations of camphor, menthol, and wintergreen. And you can apply those to your abdomen and just kind of massage over the areas that you're noticing the pain. Now, I will say it's important to make sure that if you're using essential oils, that you are using a high quality essential oil that has true products in them, because not all essential oils are created equally. So just make sure you do your research on them. Other supplements that we know can be helpful include omega-3s. So you'll hear me talk a lot about omega-3s as far as helping with circulation, anxiety reduction, and depression reduction, but it also helps with inflammation and pain. So omega-3s are great. Whether you're getting them through seafood products that you eat or whether you're taking an actual supplement, the omega-3s on a regular basis can be really helpful. The other supplements we talk about typically focus more on reducing inflammation in general. And so those are going to be things like ginger, turmeric, and magnesium glycinate. Now, it's really important that when you're doing magnesium, we want to look for magnesium glycinate. This one is not going to cause increased problems with bowel transit. And so we're not going to be having problems as far as diarrhea if you're doing the magnesium glycinate version. The other areas that have had some great study when it comes to supplements are on the B vitamins, specifically B1. And so in general, you can take just a B vitamin complex around the time of your menstrual cycle in order to help and boost those B vitamins. There are also some other over-the-counter supplements that you can take that are specific to endometriosis. And now, endometriosis, as we've talked about in past episodes, is really challenging to diagnose. It typically is diagnosed with a laparoscopy, and that is a surgical procedure where they take a camera and actually look inside of your belly. Now, with that being said, there are certain things that we know can point more towards thinking, hey, this is probably endometriosis. And if that is suspected, there are these certain supplements that can help with endometriosis type pain. So the two that have the most study for data behind them currently are N-acetylcysteine and pycnogenol, which is actually plant extract from pine bark. Now, both of these are antioxidants, and they've found to have great improvement of pain, specifically when it comes to endometriosis. Now, both of these would be recommended to only take at the discretion of a healthcare professional, because again, we want to make sure that that's what we're actually treating. So again, N-acetylcysteine and pycnogenol to help specifically with endometriosis-related pain. There are certainly other over-the-counter medications that can be used to treat pain. Most of the time, once people have come to see me, they've already tried some combination of over-the-counter meds like anti-inflammatories such as ibuprofen or naproxen, or classes of medications just like acetaminophen or Tylenol. There are also prescription strength medications that can be used in order to help with painful periods. And depending upon what your particular symptoms are, there are different medications that can work better than others. For example, we have found that mefenamic acid, which the brand name for that is Ponstel, works really, really well for ovulatory pain as well as for menstrual-related pain. It just seems to impact those reproductive organs more significantly than some of the other anti-inflammatory medications. The other things to kind of think about when it comes to treatment for pain relief would be hands-on therapies. So physical therapy is a fantastic avenue, especially if you're working with somebody who specializes in pelvic floor physical therapy, can be very beneficial to help with pain relief. And then the other category to talk about would be acupuncture or acupressure. There are some great pain points for relief if you are working with somebody who is a licensed acupuncturist, to help manage that pain. And there are things that can be done when you're having that acute pain, as well as things to focus on trying to heal even between cycles so that you hopefully don't have that significant pain once your menstrual cycle does come on again. So how do I know when I should seek more help? I'd love to try all of these supplements and try all of these things, or hey, I've already tried all of these things and these are not working. And really that's a good indication that it's time to seek professional help. If you have tried many of these different supplements or a lot of the regular over-the-counter stuff, and you've done the heat and you've done essential oils and you've tried it all, really that's the time to say, hey, I need some professional help here. The other is if you have pain with your menstrual cycle that lasts more than 2 to 3 days. So even if your pain is not so intense that you can't function, but it's lasting for more than 2 to 3 days, that's really an indication that you should have evaluation. In general, we should see that pain should last no more than that first 2 to 3 days and then really should ease up significantly. The other time that it's important to get help is that if you are having severe pain that inhibits your ability to go to work or go to school, then you should absolutely seek evaluation. It is not worth it to live at that level of pain when there are so many things that we can do to help reduce the pain, ultimately find the root cause, and make sure there's not some other underlying reason that you were in such significant pain. Imagine if your periods weren't so painful that they limited your daily activities. This way forward is possible through working towards a better understanding of the root cause of your pain. I look forward to working with you to achieve more natural cycles with less pain so you can get back to living your best life. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.